Can start now.
Yes, sir, you can start now.
Right. Now you see, medical meteorology is a fairly old term that was earlier used by British doctors, but then thereafter for 100 years or 150 years it was not used. Now, what I have started using it from 2004 2006 first publication. Now, meteorology is a science of weather, and our weather creates severe natural events. So if we can interface the both, then we can really make out something good from healthcare perspective. Now, you see, severe cyclonic conditions are associated with clouds that are 5 to 10 kilometers in thickness. This means very, very thick. And their domains can be 10,000 square kilometer or 40,000 square kilometer, 50,000 square kilometer. Now, large cloud, this is, it means continuous alteration in water carrying mechanism and results in buoyancy failure. That means if there is a lot of water in it and there is a vector, that is wind is slow, then buoyancy failure will happen and consequent load shedding, that is what we know as rain or precipitation. Now load shedding results in rapid alteration of barometric pressure because उसमें उसका वजन कम जाता है cloud का. And there is a paddle effect, there is a no paddle effect. Paddle effect means ground, lot of wind. No paddle effect means still conditions. Hence clouds or systems, rain-bearing systems, shift from relatively barometric high to relatively barometric low. I am explaining in very short, very simple, this multidisciplinary work. A complementing natural phenomena is this, that the clouds will move away from high to low. Always it is inclined and due to gravity towards the cloud portion that has more water because of the weight and gravity, earth gravity. Thus, cyclonic systems travel long distance because of this engine type or potential, and they remain active also for long period. Plus, there is lot of variability because of the variable ground conditions, atmospheric conditions. Now, barometric pressure affects. Now we come to health science, health aspect, clinical aspects. Barometric pressure, actually what happens, it affects all forms of biological life on surface and in the interspace sky, that is birds, avians, and amphibians, including the deep sea. Now, barometric pressure in the coastal region and barometric pressure in the hills and in the interzone plains. Now, coastal region barometric pressure ranges between 995 98 hectopascal and is consistent over a large geodomain, and the cycle period window is 6 hours. But in the hills, all this is very short, and the cycle period is 30 to 60 minutes duration only. Moreover, hills offer exponentially large surface area than compared to ranges. Now, compared to the plains, not ranges. This is a spelling typing error. Compared to the, now hills offer very large surface area. जमीन बहुत ज़्यादा होता है, हिल को आंख में देखने में कम लगता है, लेकिन मापने से समतल भूमि से प्लेन वैली एरिया से कई गुना ज़्यादा होता है. This is the cause of hill drainage unable to cope up with the inflow. अब बारिश जो होता है, it rains on a very large domain, although within a very small framework of area, but the surface area is many tens of times, maybe more, resulting in flash catastrophic flood. In the valleys, the drainage has a very wide cross section. In the hills, it is just the reverse. That is why you have this gushing water, high velocity, speed, because more fluid has to flow down. Now hillside flora further multiplies. Ek jhad, that is one tree, can maybe having few hundred square meters, maybe even 1,000 square meters of extra space, which is all in the air. It is not on the ground, but the water that falls on the tree, it eventually comes onto the ground within 10 square meters. But the tree itself has few hundreds of square meters. So it catches the rain and then transfers it into a smaller area. So there is a lot of water. Finally, the topsoil and the flora, they jointly release trapped water, that is the rainwater, in via a delayed action mechanism. वो तुरंत उसको नहीं छोड़ता, उसको पहले सोख कर लेता, फिर saturation होने के बाद the water flows out. Then there is something called Moon, M-O-U-N, Moon phenomena. And water soaks down, then there is the bedrock, in between the water goes down, and finally a slime builds up between the rock and the soil, and the soil, because of its additional extra heaviness due to the water that has trapped in, it slides down, breaks away, and landslide happens. This mud goes and eats or blocks the channels which are already narrow. Now we have to go to the next slide. Now bilateral hills and plains. This means bilateral hills, there is a river stream such as the Indus, as you imagine at Hyderabad of your country, or you imagine in Kanpur or Patna or Lucknow or Prayagraj in India. You will see on one side we have the Himalayas, you have the Quetta Hills on one side of the Indus, and on the other side there is plain land. So this is bilateral. Now warm coastal meteorology in one. Now warm means usum, and mountain meteorology too. Then they join. One is warm, the other is cool, and cloud bursts are eminent possibility. With two thermal contrast system, conjugation happens. That is, two water bodies in sky, they join and conjugation, and within 2 to 6 hours all this happen. And while the astronomical quarter is of 6 hours maximum, so within 2 hours you will have catastrophic rain in the hills, but within 2 hours, after 2 hours it stops. But if it does not stop, as it happened last time, then there is very, very big difficulty coming downstreams and along the stream edges, even in the upland areas. Now, a system from the coastal region, suppose from Karachi, it marches onto the hill regions, then too much variability is noted in pressure. Now, as the cloud bursts, let us go to the previous para. Cloud burst means all of a sudden a lot of water falling from air to ground, so there is change in pressure, apart from all other issues. Now we are talking about pressure because we will eventually connect with blood pressure and with other, that which governs our tissue performance, tissue perforation force. Now a system from coastal area provides lot of, or inflicts lot of variability in pressure. Now in Pakistan, August 22, 2022, we see on the right hand side, as we look from south to north, on the right hand side there are no big cities. Big cities means concrete jungle, and there urban heat island, that is lot of heat will generated there. But in Midland Park this is absent, completely absent, no big cities. Now conjugated, upregulated with, but this north-south flow, when they conjugate primarily because of the western disturbance, and western disturbance is dragged in down along the Indus. Now system then swing towards the terrestrial gravity, Now, terrestrial gravity becomes then the bigger player in place of urban heat island. Now, terrestrial gravity means the plateau system, Quetta is a plateau, and all the clouds, they are attracted more towards the left as we look north from south. So, domain Quetta and buoyancy failure happens, cloud burst continues, that's heavy rainfall happens. Now, we go to the next slide. I am showing you here in this picture how the hills multiply the surface area at the bottom picture, and the cloud columns are not actually flat. It is from the ground that it looks flat, but in fact they are very deep and vertical. So it can keep on raining and raining. Now, we have talked about pressure, we have talked about cloud burst. Now, astronomical gravity, sun and moon role. Now, full moon and new moon conditions, Purnima or Amavasya, exert astronomical gravity, and the rain system, that is the cloud, having big mass, having become very large and powerful, they also trap much greater energy basket and also longer stay put property. That means a rain system can stay on land for longer time. Now, every time astronomical gravity plays on cloud and this thing happens, the biological life on the ground gets a altogether different environment condition. During astronomical gravity, river mouth discharge are very inefficient because the tide is coming in. Sea does not take water at high speeds because of the high tide, so there is actually a reverse flow into the valleys, into the delta, into the valleys, nor greater volumes. Even greater volumes also come down because of the deposits, because of the high velocity, high energy deposits. In pedology, they are known as high energy deposits. Now, water that inundates collateral areas never drains off. Now, water swells and it goes into the neighboring areas and it stays put. Now, in August, during this, pre to this catastrophe, we find there was a super moon, the fourth one this year, and the moon was at perigee, that is nearest to Earth. Finally, in plains, catastrophe can happen normally only after days of continuous rains, and the water flow out into the sea is slow, sluggish due to less gradient, and a 2-day reduces and 2 days, and the days reduces and stops due to tide effect. This is the finding. Now, this is the observation which results in flood. Now, flood means completely different conditions for the clinical community. Catastrophe flow pattern in the hills happens within 12 hours. That can happen in 2 days, in not less than 2 days. Here, in 12 to 18 hours of continuous rain, it can become very, very big catastrophe. As it happened this time, and we keep on seeing these things in the Himalayas, all along the Himalayas in the India mainland, and the two masses, that is the cloud mass in the plain region and the cloud mass from the hill region, they meet in the mid plains or in the upper delta region and cause high floods. That is even the water that has come down from the hills, they finally meet. So, pre to Sukru barrage in case of your Indus, or after Sukru barrage, that is in the plains, that is in the delta region. Now, severe conditions. Now, we have so far tried to understand how severe, what are the severe conditions and what are the genetics of such severe conditions. Now, on our human beings, on us, severe conditions, the ones that have been discussed earlier, they cause release of oxytocin in extra large doses. Oxytocin can be released even for slight environmental changes, but they are not very large doses. We need large doses. Now, oxytocin reduces spring yet balanced reaction ability. Our all of a sudden getting up, running away from a disturbed place, or running on toes, all running in a balanced manner without hitting and falling. All these things will go for a 6 if oxytocin has been released. This is why the commandos, the law and order personals, they are continuously put to practice. That is what you call as learning by constantly using all your parts under strained conditions. Non-synchronized brain sensory limb movement happens in case of oxytocin in very large dose has been released, and it can lead to freak accident such as a person hanging on a wire while crossing a stream. He might be doing that on and off end throughout his life, but when that stream is in roaring flow and with muddy water in place of pristine flow, his oxytocin levels go up because he thinks, if I fall, what will happen? And by that thought, his oxytocin levels go up, and we have seen on and off and that even that practice person loses the grip on that wire. Genetic causes and upregulators. Now, oxytocin can be upregulated for in release in our brain because of naked eye. हम पहली बार हमने कुछ देखा disaster, very आंखों देखा disaster देखा, and we get frightened, or we hear a crowd mania, hearsay, bhago bhago, run. So we develop a fear and we develop tension. The real event, acoustic conditions, hurtling, crushing, suppose a stream or trees breaking down, homes breaking down, all these sounds can create a condition for oxytocin release. And if there is pre-existing phobia, then oxytocin will be released in very high condition, quanta inside the brain, and that particular person is exposed to near fatal and fatal conditions. Actually, it may not have to do anything with the severe weather or with any of the other conditions that are happening on the ground. Now, this means administrative headache. We do not understand why this person has died. We think he died because of the severe weather event, and finally we say because of global warming. Less understood primary causes. We have this oxytocin matter is well understood because it is used. The injection is available as an intramuscular, but of latest is the sulfolipids. The sulfolipid mobilization causes fear. Now, release of oxytocin by brain at the same time, large doses upregulates. Now, this is extremely dangerous for TB carriers, tuberculosis, those who have low HDL, that is the good HDL, those who have good or friendly lipid, those who have less, for them it is bad. For geriatric persons, for convalescing persons, those who are in hospital or even being treated at home, they fail to respond to emergency and or they respond in a wrong manner. That is, they have to go take a particular door outside, they take a door on the reverse and move inside, and by the time something more goes wrong and fatality occurs. It has got nothing to do with global warming. That particular fatality, that particular mortal case has got nothing to do, but is a matter of our lack of understanding. If we had some medical meteorology personnel there, then all these things would not happen. A great or large percentage of fatality occurs due to house wall collapse and unnecessary risk-taking, indolent behavior. The river is in spate and people at that time want to cross. They want to go and meet their some relative. This is the problem. This adds onto the numbers of death or devocalized persons, and it finally is reported as a failure of the administration. Now, sulfolipid mobilization in HDL compromised persons, that is low density lipid compromised person, results in sudden urge to defecate. In the those who have a lot of sulfolipid mobilization tendency or syndrome under stress condition, they have a sudden urge to defecate or to empty the bladder or during critical moments. You may see in your office environment, in your working conditions, whenever some tension comes, some people go to the urinal. Also, this is because of sulfolipid mobilization. And in the out, during severe weather, where life and death can be a question mark condition, at that time sulfolipid mobilization is definitely heavy. Also common among irregular or irritative bowel syndrome patients, this sulfolipid mobilization. However, now sulfolipids do not affect the pediatric, nor oxytocin is released. But these children, this child, infant, they wet their parents' bodies, arms, or if they are sleeping, their bed, they wet their bed and cloth. This is primarily due because of steep, that is not STPP, but steep barometric pressure alteration effect on colorectal and bladder. Physiological aberration scenario. This means this is a physiological aberration and it has got nothing to do with the actual global warming. Global warming may cause this cyclone, but it is debatable because cyclones are part of our tropical environment, and it is very much necessary to move the rain-bearing system inland. Therefore, we cannot directly put the blame on global warming happening in our domain, in Indian subcontinent. Now, we have discussed about earlier how the environment can make changes in the pressure column. Now, in the average is of 1000 to 970 hectopascals, or even sometimes 960. 960 in case of cyclone, standard cyclone. Beyond 960 becomes very, very, very serious cyclone. That type has not happened here. The one that we have experienced in India, Bangladesh, Myanmar, Sri Lanka, Pakistan this year, none of them had 960 central core pressure. Now, whatever it is, the change is of 30 to 40 hectopascal. Now, inside human skull, that is our brain, at the blood-brain barrier level, the blood pressure is of 10 to 15 hectopascals when we are in supine state, in rest and healthy. This is the benchmark, that is supine in rest. Rest means very restful mind and healthy, physiologically also healthy, psychologically healthy and supine in a sleeping pose. Now, human hemodynamics takes time to respond to such changes to 30 to 40 hectopascal, and intracranial BP shoots up, resulting in aneurysm, blood leakage, minor blood vessel bending up, twisting, and strokes happening. Now, also they can happen. It can result in epistaxis, blood flow from nose, lower limbs in the plantars, which is known as vasculitis. Now, because of blood pressure, the fatality group, however, is the comorbid cases, not the healthy, the geriatric, those who are overdrugged, and those who are regular pill poppers. That is, they are too much dependent on pills. Here in this graph, we see that there is a curve OX is the x-axis. OY is another axis, is the sky axis. That represents atmospheric pressure. Now, curve OC represents unaided lungs expiration at rest. That means how much air the lungs can push out at rest. जब आराम से खड़े हैं. Now, if we look at study this, then we will see that as the pressure falls, the expiration efficiency and volumes, they go up. That means barometric position acts as an aid, just like our inhalers. For asthma patient, bronchodilators, this is not a bronchodilator, but it actually removes the opposition outside the mouth and nose. As a result, our lungs can push more air out. The moment it pushes more air out, equal amount of air or even more moves in and enlivens the alveoli, the deep lungs. And we, the people, tend to become more fresh during and more playful, more happy when a cyclone is approaching us, and even provided we are not afraid. For humans, animals, breed stock. Now let us go to the box on the right side. For humans, animal breed stock having large airways, moderate low pressure is good, and they get lifted and thrown asunder. If the pressure goes very, very deep, low, then they can be straight away lifted, as it happens in United States during the tornadoes, land tornadoes. They are lifted and thrown asunder. Now, deep, low pressure aftermath is full of consequences, because first it is thrown out. Second, gravity waves. All the atmosphere, all the cloud that has come, they cannot move any further, so they have to all of a sudden fall down. After some rains, rain has to stop because the rain mechanics conditions do not exist. So the rest of the moisture, they fall straight vertically down. These are known as gravity waves. During this time, the pressure goes up. Soon after low, there is a pressure. There is a high pressure, clear sky, and the lungs are unable to push out the oxygen depleted air from the lungs. This can result in, one is when you are lifted out, when there is acute low pressure, if you are lifted off your feet, it can result in pulmonary infections, sudden unconsciousness, and fatal. And when the gravity waves come, it will result in khasi, lot of cough, lot of problems, and there will be in the clinic, hospitals, there will be running around of the clinical staff for the all sorts of ventilators and assisting equipments, breathing assisting equipments. Next slide gives us three diagrams. On the left, we have the diagram of a person, that is figure 1. You can see is an asthma patient who has not been given any medicine. The same asthma patient is given bronchosteroids, bronchodilators, that is puffs. And you can see the same remain condition only in case of jagged inner wall, that is the lumen of the bronchus. It has smoothened out a bit. Otherwise, it is all same, identical. Now, on the third right-hand side ring, we can see that the same identical condition happens when there is a weather system of 980 hectopascals, that is rain-bearing system or a cyclonic system, is overhead. But all the three conditions are same. In the second condition, we are given medicine, and in the third condition, atmosphere acts as the low pressure acts as the medicine. So this is medical meteorology. It has got some sort of cyclones also have some good effect. But soon after, gravity waves come in, and this very patient who was very hale and hearty, who was happy because of he was able to breathe very smoothly, all of a sudden develop complications soon after the system has passed. Now, A mother who is in third trimester, that is in very advanced stage of pregnancy, will generate a abdomen muscle contraction force of 30 to 40 hectopascal. Now we are having already a 50 hectopascal of muscle contraction. Now we are already having, by God, by Mother Nature provided, a 30 to 40 hectopascal reduction in the atmospheric pressure. So the invisible opponent has reduced by 80 to 90%, and there is a ease labor, very easy labor, comfortable childbirth when there is a cyclone raging in the out. Now, during cyclone, and particularly the first time mothers, prima gravida, they enjoy, if they enjoy more comfort, they enjoy more smooth labor in case there is a deep cyclone or a severe cyclone happening. And even during, because of the cyclone sounds, the swelling sound, the rain sound, the psychological, there is extra oxytocin released, and oxytocin is required for generating that labor abdomen muscle contraction, the synergic movement of the muscles, so that the baby can come out. Now when cyclone passes away, then labor becomes painful. Also there is more bleeding because of the of friction and other things. Therefore, during severe weather conditions, call for the midwife arises in the remote of the rural region. When there is a cyclone going on, at that time in the peak hours, there is an urgent call for midwives. All hospitals have closed down. All doctors have gone away to cities. All have run away. There are nurses not available, and only the midwives and some old nurses, some local nurses. So this is a very, very important thing. I hope all mammals and eggs develop also benefits. They all come in hatchlings. They all come out during the low pressure. That is why you will see all sorts of creepers, all sorts of earthlings, small. They are moving around all over the place soon after a very severe storm or a cyclone pass. Now, flood, and we have seen from the sky. Now let us go to the flood on ground situation. Due to the flood, and after the flood, the flood will subside because it's a limited time phenomena, but extended of a week or maybe a fortnight long. Now after that, what happens? Bright sunshine comes out now, as it is happening all over the Indian subcontinent. After a cycle of very, very intense rain, we are having intense sunshine. It will result in good agricultural activities, other thing, but also a lot of entomology bloom. Caterpillars who eventually will become butterfly. They will multiply the cycle, horticulture cycle, agriculture cycle, all these things. Now, other vector-borne diseases is malaria, filariasis. They go into overdrive. Now the standard medicine is already available in the market, available in the hospitals and clinic. But we find that elagitanins and elagic acid, galagic group of acids, are very useful in case where standard medicine has not reached, but Mother Nature has caused some havoc. Elagitanins, elagic acid, galagic acid, they are available in fruit carbs, particularly of pomegranate. It's very rich and there are no other confounding. Now floods also increase anthrax risk. Anthrax is caused by bacteria, so tetracycline, doxycycline are the drugs. Floods also increase the possibility of plagues because the rodents they all get killed, and they somehow survive by biting or eating some rotten some carcass. So the treatment is tetracycline, doxycycline again. And floods also increase foot and mouth disease, which is virus cause, and it happens in the bovine category, the cattle. Ellagic acid, galagic group of acids are antivirus. So these are some sort of functional food-based interventions. Now floods also increase snake bites and fatality. Snake bite, there is no way other than having snake venom injections and infusions ready. Very, very difficult in rural and remote areas because you also need cold chain. Now diarrhea, we already have a lot of standard medication for that. Amoebiasis and related gut parasitemia, standard medicines are required, but this galagic group and ellagic acid and ellagic tannin, they are also very, very useful and supporting they support the Akkermansia municipalia of our gut. That is the gut environment. Now psoriasis medicine is standard, but we have got some functional food in the next somewhere in a later slide we will be looking at it. Now wildlife. Humans we have seen other right now we see we have seen egg-borne animals and that is the hatchling route. Now we see wildlife, a very rare and difficult vector-borne disease that strikes the wild animal, including the zoo animals, are trypanosomiasis. It easily strikes the wild and there is swift mass mortality. The drug of choice is diethylcarbamazine. Now, domestic cattle during flood exhibit strong hard character. That is, they sit all together because it is wet, the ground is wet, the atmosphere is. So they are also scared about what has happened. So they all sit together in tight packs and they facilitate cross contagions and mutations. So they need to be given washes with all sorts of medicines, veterinary medicines. One of the easiest way is, or the most economic way is boric powder wash with mixed in either saline or in water. Boric powder can also be used in flood water and used for animal skin washing and for failing any mutation. And foot and mouth disease among buffaloes. An interesting observation is that in our area, buffaloes, we have this flood on and off, and muddy water flowing down the, otherwise those rivers are dry in the dry season, completely dry, and during monsoon there is a muddy water flow. Buffaloes that cross these rivers or these streams and they do not tend to pick up foot and mouth disease, nor they pick up dermal pathologies. Even human beings who swim or live in these muddy waters and do fishing, they have no skin pathologies such as scabies and dermatitis, etc. Now, for all these things, that is for flood region or in flooded regions, what can be the functional food and practices? One is pomegranate, jackfruit, all those fruits that are harsh juices. Avoid temperate food, highland foods, that is eatables, also eatables. Diospyros melanoxylon, it also has harsh juice. Maduka indica is very good at energy, provides energy on very small quantity, and also it has a calming effect. Then calcium hydroxide, poppy seed, that is inert, mustard oil, it can be used for cooking, and it is very, very good. It actually lyses all the viral and bacterial lipids. They completely lyse the lipids. And once lipids are lost, then they become inert. Wetland economic variety rice, rice normally in the above 30-degree parallel, above a very big rice, those long rices are available. But people in the coastal area, they take low gluten food and rice. That rice should be kept. Then aram, kaddu, green plantain, chuda, pop rice. These are all kept packed here in our place to be shifted to emergency required locations, and they are always in peak loaded conditions. We have in hundreds and hundreds of places here which may not have been adopted in other nearby countries, but we certainly have all this, and some of them are new here items. Carbolic acid wash, that is diluted carbolic acid of flows, and even ultra diluted can be used on the animals, on the plants. Now monomeal to reduce gut problem and defecation problem, monomeal per day. Now during the floods, people forget for oral and dental hygiene. So and also these are not available. So waterlogging, individual specific allergens, every individual has individual specific allergen. What I mean to say is that during the floods, if you look into the fossa, we will see that every individual, the rural people particularly, they have a different type of allergens and they do not have a common type. So, and their oral fossa and epiglottis are all inflamed, are all in inflamed conditions. So brushing with brush and or neem and or Staphylococcus asper twigs completely reverses the negative conditions or the adverse conditions in the fossa and epiglottis. Then there are the other foods you will see if you go to the flood regions now. People are coughing, they are wheezing, they are sneezing, they are passing all sorts of sputum in all sorts of quantities and also sometimes greenish. This is because of allergy and because of systemic inflammation. So haldi plus honey plus betamethasone, only half tablet, that is 0.25 milligram at the most. This will reduce hoarse throat, sputum, and spitting need. People will be spitting in the so flood and inundation, good aspects. We have already talked about some. We have already talked about the medical as good aspects as well as bad aspect of the cycle of the environment. Now the flood, topsoil toxicity reduces, acidity increases, plant require all sorts of agriculture, floriculture, horticulture, they all require a acidic soil, not alkaline soil. pH change and floods bring acidic soil. pH change in soil becomes more acidic. Now plant pathology, disease incidence initially is affected, it goes up for some time, maybe a week due to a flood, and there is because of a sudden alteration in agromate conditions, but on long period proves very beneficial. Floods are very beneficial for agriculture in the long period. Aquifer recharging happens, water table is available. Now anti-aridification happens. Now already Pakistan and even to the east of Pakistan, India is facing aridification, and this type of excess water available on either side will certainly downturn desertification, creates sustainable employment, because after the floods, the agriculture activity picks up, the marketing, the carriage, logistics. So when there is dry condition, the employment demand in the rural areas fall. So flood is nothing but Nile Valley civilization phenomena. We have to harness the good. We have to understand and not be afraid. Now, alert and attention during flood or any calamity time. High potency drugs are used. Multi-drug therapy is used. New antibiotics are introduced and also tried unofficially. Unofficially, in very large scale, on the pretext that so and so antibiotic is not available, this group is not available, that particular label is not available. So whatever is available, the administrator has to okay on emergency basis. Now, if we have a plan, then we can easily avoid not to use on naive and pristine physiology, because in the villages, people are not exposed to high potency drugs. First of all, they are not at all used to the modern pharmacology. Then next is they don't use the high potency. Then there is complete absence of family physician and pharmacists. This should be encouraged so that family physicians can actually address on very large scale. And they can also act as storing place for emergency medicines, emergency conditions, sorry. Now, adulterated drug moieties are also marketed. Substandard APIs, that is your active principal ingredient, it will be written as 100 milligram, but actually there will be less than that, than the label. On the label 100, inside less. So this has to be, this can only be checked long before, not when the emergency has struck. Then another aspect you will see throughout, right now Pakistan, if you check, even in our side, orthopedic clinical intervention becomes a crying need because of wall collapse, boat capsizing, tree fall, vehicle has been washed away, so bridges have broken, so people have hit and their bones are broken. So orthopedic clinical intervention is a crying need, and we are not providing anything. Needs to be addressed. This is another near vacant area. And now we come now to the reference. I had actually started 2006 when Dr. Kalam was the President of India. At that time, he had asked me to write something on this. And when he read my first paper, it was encouragement for me, and it continued. And it's still now continuing. Thank you very much. I will now, but however, you see, although here in India, we have been planning for natural emergencies of various types, out of which flood control and flood management